So what is the main muscle for responsible for shoulder horizontal abduction? It is posterior deltoid. So how should we position the patient for grade 5 for examining grade 5, 4 and 3 shoulder horizontal abduction? So the movement should be against the gravity and the position is same as for internal and external rotators of the examining for internal external rotators of the glenohumeral joint or shoulder joint. So you can see again the patient is prone lying. He should be facing towards the test side. Arm is supported by the towel roll. Arm is abducted to 90 degree and elbow is flexed so that the forearm is hanging outside the couch. So now the therapist will perform the shoulder horizontal abduction and find out what is the available range of motion. After the available range of motion is found, the patient is instructed to perform actively against the gravity. You can see the movement is against the gravity. Then if patient is able to perform grade 3, then we'll move on with examination of grade 4 and 5 by applying the resistance. So the position is prone lying, shoulder abducted 90 and everything is similar to internal and external rotators of the shoulder. And the test that the patient has to perform is horizontal abduction against the gravity, and while applying the resistance we can instruct the patient to hold the position and let the therapist not push it towards the or against the movement. Now if patient is not able to perform grade 3, then we'll move on with examination of grade 2. So what should be the position for horizontal abduction in gravity eliminated position? So here you can see the position of the patient should be in sitting position, or you can see short sitting position with arms supported on the table or the couch. Here you can see in the picture arm is supported, shoulder is abducted to 90 degree and elbow partially flexed. So in this position the therapist first will apply the passive range of motion to find the available range of shoulder horizontal abduction. After the available range is found, patient is instructed to perform himself or herself the full range of motion in gravity eliminated position. So if patient is able to perform full range of motion in gravity eliminated position, it would be graded as grade 2. So positioning is short sitting with arms supported on the table or the couch and shoulder is abducted to 90 degree, elbow partially flexed. So the force of gravity is cut or deleted or removed by the couch which supports the arm. And the test is patient slice the arm across the table in horizontal abduction. So we'll move on to demonstrations for shoulder horizontal adduction. So what is the muscle responsible for shoulder horizontal adduction? The major muscle that is responsible for creating shoulder horizontal adduction is pectoralis major. So for performing or examining grade 5, 4 and 3 manual muscle testing for pectoralis major or shoulder horizontal adductors, the position of the patient should be supine lying. So the position of the patient should be supine lying with shoulder abducted to 90 degree, and the test is patient is asked to perform horizontal adduction. So it should be performed across the chest in a straight pattern with no diagonal movement. So you can see the demonstration video here. First, therapist will perform passive range of motion to find the available range, and then the patient is asked to perform against the gravity shoulder horizontal adduction. If patient is able to perform against gravity without any assistance, then the resistance would be applied at the end range and instruct the patient to hold the position. If patient is able to hold the position against the resistance, it would be grade 5 or 4 depending on the amount of resistance applied. Again, you can view the demonstration here. shoulder horizontal adduction, passive range of motion. Patient is in supine so that shoulder horizontal adduction is against the gravity. If patient is not able to perform against the gravity, then we have to alter the position of the patient and test for grade 2. So we'll move on to testing for grade 2. Again, the position is same as for shoulder horizontal adduction, that is shoulder horizontal abduction, that is in short sitting position. So first patient will therapist has to find the available range, and then the patient is instructed to perform shoulder horizontal adduction, which is being supported by the couch so that the gravity force is being eliminated. So the position is short sitting with test arm supported on table at level of axilla with arm in 90 degree of abduction. And the test that the patient has to perform is to attempt for horizontal adduction of the shoulder where the arm is being supported.